Hi, welcome to Little Bohemians. My name's Khadijah Anderson. For 18 years, I've worked with children in early childhood education. For the first 8 years, I worked in large daycare centers as a preschool teacher and a toddler teacher. And for the last 10 years, I've had my own daycare in Los Angeles called Little Bohemians Daycare. Actually, I take that back. I started off in Seattle for 2 years, and then I moved back to Los Angeles to my home and did Little Bohemians here. So today I want to talk to you about diapers. Okay, diapering is an interesting topic because parents come to me and they have lots of different ideas about diapers. And I've had lots of experience with diapers, as you may well imagine. After 8 years of working, some preschools, some kids are still in diapers, some aren't. Toddlers definitely are in diapers, most of them. And of course, for the last 10 years, I've had a mix of children from infants up to age 3, and actually up to age 4. So I've had lots and lots of diapers. So I want to talk to you about different sizes of diapers. As you can see, there are a lot of sizes. This is a size 5, and this is a size 3. So just so you can see the comparison, the diaper manufacturers put on their packaging a weight range for each size. That's okay to use, but really, depending on if a child is a certain weight but then very thin, maybe, that the diaper is going to fit differently, of course, than a child who has a little more body weight and is maybe bigger. So that's not a complete thing. So what you need to look for is how the diaper fits your child. Okay, so let's look at a few. Size 5, as I started with. Size 5 is really huge. I have only ever used a handful of these for a handful of children. I don't mean a handful of diapers. I mean a handful of children in my daycare have used a size 5. They're mostly close to age 3, a few 2-year-olds. But this is a pretty big diaper, so you might not be using this. Maybe you will be, all right? But I'm not going to talk about a 5 today. The 3s can be really tiny, as you can see. These are two different size 3s, but as you can see, the brand that's back here is definitely taller than the front brand. And I'm not going to mention brands. Some of you might know what some of these brands are. You might recognize them, but I'm just going purely with size here, okay? Here's another size 3. Check this out. Size 3. This is the same brand, the one with all the cute pictures on it. I'm going to put them together here. Oh, wait a minute. Okay, this is crazy because I think I'm lying to you right now. This is a 3. I know this is a 3 because one of my kids right now is wearing this diaper. So this may be a size 2 in this brand. All right, great. So now we're going backwards, a size 3 and a size 2. Okay, wow. Let's just get rid of that one, shall we? Here's a 3 and here's a 3. I know this is a 3. Okay, there's a difference right here. This 3 is bigger than this 3. Here's another 3, different brand. Put them together. Oh, almost the same. Okay, cool. Now let's skip to the 4s. Here's a size 4. Okay, here's a 3. Here's a 4. Okay, and then here's another size 4. 3 and 4. All right, so there's a few sizes for you to ponder and be confused over. Sorry, I don't make these, all right? I'm just showing you how to put them on and what to look for. So lots of times new parents bring me children with a diaper that's way too big for them. And what I mean by way too big is I'm going to use our friend the frog here to demonstrate. Obviously this is not a child. I couldn't really use a child here. I don't think the parents in my daycare would appreciate me using their child to show you a diaper change, maybe some other things. And my youngest child personally is 13, and she'd be really upset. Really? I can't even believe I just said that. Okay, so here's the frog. I'm going to show you a size 4 on the frog. Open this up if you've never diapered before. If this is new to you and you're a new parent looking in, here we go. Here's a diapering lesson. Get it ready, okay? Have it ready, because many, many, many children do not want to lay here for you quietly while you're changing their diapers. Now, for the sake of this frog, since it's not a real child, it's got a really short torso. Pretend like its arms aren't here, okay? Pretend like the arms, no diaper should fit up to the child's underarms, but for this one, we're just going to put it there. So you're going to take the diaper and put it here. I'm doing this for comparison so you can see. Okay, I'm going to put it here, and then I'm going to do this side. Now, right off the bat, these little clasps are really tight together, and that's okay because that still works. If you had a diaper that you had to, stretch it over, depending on the kind of diaper, it's not going to stick too good unless it's on this. So this is okay, this fits. But take a look down here. You see all this room in here? Again, not a real child. A child's legs are going to be thicker than this most of the time. Sometimes not, but most of the time they're going to fit a little better. But my main point is you see how much room there is here between the crotch and the diaper bottom. This diaper is way too big, okay? And I've had kids come with diapers that big. And what happens is the child is running around, the child poops. The poop does not just magically stay in that little pocket. Believe me, the poop does not magically stay in the little pocket. It's going to come out, and it's really gross because it comes down the leg. It gets everywhere. If they're sliding down a slide or sitting, it's going to shoot out the leg as well. And then if they're wearing shorts, it's going to come out a lot faster. If they have pants on, it might stay in a little better. But basically, you're going to have a big mess. So this diaper is way too big. Let's take it off. Frog, you're being so patient. Believe me. But actually it's interesting because I've had parents come up when I'm changing their child, and the child doesn't see the parent because the parent's approaching from this side maybe, and I'm changing the child, and the parent comes up and says, how did you get them to lay there like that? How did you do that? And I say, well, I wait until they're done playing or have like a pause and they're playing. I rarely, unless there's an emergency like poops coming out everywhere, which happens, I won't interrupt their play. I'll wait. I'll watch them and I'll say, oh, it's diaper changing time. Come on over. And most of them will walk over with me or come to me. I can actually, shout across the play area, hey, come over for a diaper change. They'll come over, they'll lay down, I change them, they get up, they go, I wash my hands. Parents all the time have told me that never happens for them. So I'm sorry. Lots of things in daycare work and at home, children just know that we're all different, right? But in my place, they know that we change diapers all day. That's what we do. Okay, so that was a 4. Let's skip to a 3. Let's try the fancy 3. I like these diapers. They're really cute. I know they're really expensive, sorry, but let's try it on our frog. Okay, again, I'm going to put it up under the arms just so that we have we can compare. And then the front, open it up. Now, one trick you can do to get your child to cooperate and lay there is to give them a toy. Because also some children want to reach down and grab, whatever's down there, including a poopy diaper, which is really gross. I have a child doing that right now. So when I take that child for a diaper change, every single time I make sure there's something I can hand that child so their hands are playing with a toy rather than sticking down into the diaper to see what's going on down there, because there's interesting things, obviously, happening. And that's kind of a cool thing, too, because you can use a little sign language at that time. And I always forget the sign for pee versus poop, but what I know is that poop is like this. You make a little, your thumb goes through and you do this, poop. Sometimes I just do this, poop. And then if I do that every time they change, I say to them, oh, you had a poop. Then they're getting sort of they can feel that by the age of 12 months. This is why some children can potty train quicker than others, because if they can feel that feeling and have a concrete idea of what that is, which is a whole nother topic, concrete versus abstract thought. But in diaper changing, it's helpful to give them a concrete sign, because then maybe they can sign to you, poop, poop. Anyway, that's another topic, but I do that a lot of times. So let's take a look at our frog. Okay, looks good. The little straps are meeting. Yay. Oh, wow, check this out. Check this out. Okay, this is good because you see how close it is to the baby's bottom, the frog baby's bottom. All right, now, of course, again, a child's going to have a bigger leg, but if not, this still fits okay. I'd say this is a win. I think this is a good diaper. All right, let's just try the smaller size, the littlest. Let's try the littlest size. Is this a 2? I don't know what this is. It doesn't say. Let's just try this. Oh, no, this is a 3. Let me cover up the brand name. This is a size 3 because I don't want to promote one brand over another. Except maybe then they'll send me diapers, but I don't need diapers. Parents bring me diapers. Let's try this. This is a 3. How How bizarre. Does it mean this is a 4? You know what's really interesting? I know for a fact that this is the same brand. I know this is a 3. It does not say, but I'll tell you what. This is a 3 also from the same brand, but this is a really old diaper. I've had this diaper left over for a few years from another child that was here. So I guess they made their 3s bigger, right? Because I guarantee you these are both size 3s. All right, back to the diaper. Wait, now I'm confused. Okay, here we go. Let's see what happens when you put one on that's perhaps too small. So parents come to me and they say, oh, I changed the diaper size because poop was coming out through the back. So I say to them, yes, sometimes that happens when the diaper's too small. Okay, hey, guess what? It is tighter. It's tighter around the legs, okay? There's still a little room in there, so that's good. So I guess, you know, outside appearances, they looked like they were a lot bigger, but they weren't really. Okay, so the 3 is good for this frog person. Thank you, frog. Doot, doot, doot. Okay, so what happens is poop comes up through the back. I know that happens a lot. It happens here. It happens here a lot, so I'm not saying that that doesn't mean a diaper's too small. But what I'm saying is most likely your child is sitting. And if your child is sitting and they're pooping down and they're sitting, where's the poop going to go? It might try to come out the side, and it might most often come up the back, okay? So that's a really common thing. I don't think it means when that happens to your child that the diaper's too small. In fact, I'm just going to make a declaration. It does not mean that the diaper is too small, okay? Sometimes when they're laying down, babies, little infants, a lot of times poop comes out the back again. They're laying down. Where's the poop going to go? Quick, up the back or out the sides. Okay, so it's not an indication that the diaper's too small. Try a different style because, as I've showed you, the different brands have different sizing, a little bit different. And if you buy a brand that's too big, we just hang on to it because, look, in a minute your child's going to need that bigger diaper. Thank you so much for watching. Put some comments below. Subscribe to my page. I'm going to be doing different vlogs on lots of topics like common issues that you run into with toddlers, abstract versus concrete thought, this idea that I mentioned a minute ago. I'm going to be doing crawling, walking, food, naps. I know that's a big issue. So please subscribe. Ask any questions that you like in the comment section, and I'll be sure to get back to you with a new vlog answering your questions, hopefully, and more. Thanks so much.